The member for Mildura.
Thank you, Acting Speaker, and I'm more than happy to rise to speak on the Health Legislation Amendment Regulatory Reform Bill today. Anything that helps to assist with positive health outcomes in this state, I'm more than happy to speak on. And there's a fair bit in this bill, and I know that there has been many members in this place today sharing their personal stories, which I appreciate because it does add humanity to things like this, to regulatory reform. Obviously the member for Euroa has she has had to leave the building because of her delicate situation and some occurrences during the week. So we wish her all the best. And I am predicting, I'll put it on the record, I'm predicting that that baby is coming sooner rather than later, and it will be a boy. No, it's not going to be a wombat. But also, of course, the member for Kew, like this, being pregnant is obviously one of the miracles of life. And I have said to both of them over the last week, take it easy. You're growing elbows and shoulder joints and brain matter, and those things are complicated. And I'll come back to that later because I have a little of my story to share as well. But when going through this bill, there is a fair bit to it, and things that. I'm always full of stories, Acting Speaker, and I did think of a few, full of something, and I did think of a few whilst going through this. One of them was the drinking water that this bill make amendments to, the Safe Drinking Water Act 2003. That actually got me thinking about, I mean, I'm very, very lucky where we live that we live off rainwater. We're not connected to town water at all. So in tropical North Victoria, out where we live in a farm zone, we live on rainwater. But as a child, growing up in the 80s, our drinking water, we were encouraged to take fluoride tablets. And you might remember this, Acting Speaker, the little coloured tablets. Apparently they paid off. I was at the dentist last week and she said, you must be a fluoride tablet baby because of my perfect teeth. Still perfect teeth. Maybe have something to do with my Mediterranean background, I don't know. But safe drinking water obviously is very important. I was talking to a couple of Rotary clubs over the last couple of months as well that are doing projects to help provide safe drinking water overseas, which is one of the great things that Rotary clubs right around the world do. So that got me thinking about that. And then the non-emergency patient transport under the Non-Emergency Patient Transport and First Aid Services Act 2003 as well. That allows me to give a shout out to the wonderful work of the Royal Flying Doctors Service, who are very active in our community, both with their GP service that they have acquired over the last few years and now with their community transport, which allows, because Robin Vale is an hour away from Mildura-based public hospital and that health precinct there, it is, it's very important that people can get from Robin Vale to Mildura, and they have come together in the Northern Mallee Integrated Partnerships, which I talk about often, but the Royal Flying Doctors do a great job between those two, and also Mallee-Track. There's three of them. The Mallee-Track Health and Community Services, which is a multi-purpose service, Robin Vale District Health Services, which is also a multi-purpose, and there's sub-regional health, the sub-regional hospital, which is Mildura-based public hospital, have all come together in what is known formally as the Northern Mallee Integrated Partnerships, which allows them to share resources. There's a huge amount of work that's gone into this with such positive outcomes with service delivery, particularly in those smaller towns serviced by RDHS and Mallee-Track, being able to offer virtual acute care again, being able to offer some radiology services potentially, and expanding that care that we hear is so important to deliver close to home, and noting how well the Northern Mallee Integrated Partnerships are working and have worked whilst maintaining individual governance for each health service and individual administration. Of course, being able to share some of those back-of-house resources, but it allows a more cohesive service right throughout the region, which is geographically huge. It's worked so well, and then noting while I was reading the health services plan over the last week or so, noting that the Mallee network, which is now an option on the table, which is essentially a more formal agreement between these three health services, really formalising that partnership between the three health services. And in my mind, again, it allows to maintain the local governance, the individual boards, the individual administration, but share resources, both clinical and back of house. So that, in my mind, is a no-brainer. That's where this should go, to avoid being, of course, sucked up into a much larger network that is hours and hours away, geographically so hard to get to for people in our region. The Mallee Health Network is a no-brainer, rather than being absorbed into Loddon Mallee, which I think would end up, I mean, who's to say, if we use Grampians Health as an example, and that's the direction, it would be a disaster. So the Mallee Health Network, given that is essentially, from my understanding, a rebranding of Northern Mallee Integrated Partnerships, which again have worked so well up to this point, I think, again, it is a no-brainer. The member for Shepparton mentioned before the need for GV Health to have a cancer centre, and Mildura has a cancer centre. Icon Cancer Centre has, they launched 18 months ago, I think, and it has completely changed the landscape of cancer treatment in regional Victoria. It really has. We have a radiation bunker there now. We have the ability for people to have radiation treatment on site close to home, but again, geographically huge. So Mildura Health Foundation at the moment are, of course, building an accommodation, a suite of self-contained apartments, so people that are travelling from Robinvale, Underbull, Walpyup, Murrayville, over near the South Australian border, can actually stay quite comfortably while they're having their radiation and cancer treatment. In fact, I'm doing a fundraiser acting speaker. We'll be running again the Melbourne Half Marathon in a bid to add, hopefully, a significant amount of money to that project. The slab's down, the frames are up, so it is happening, but I am running the half marathon, doing the K so patients don't have to. So, I mean, if we can, anyone wants to donate, then head to my socials. Coming back to the assisted reproductive treatments that a lot of people have spoken about with the 2 minutes I have left, and it is wonderful to see, you know, lots of pregnancies around this place at the moment. It does, you know, it stirs something new, I think, as a female. I love babies. But my journey to motherhood was not so smooth. IVF certainly wasn't an option, like it could be now, with Mildura-based public hospitals, the first to offer public IVF in the state. But it was my eldest, who is 9 years old, was in fact my 6th pregnancy. So he is my rainbow baby. And it was at the tender age of 35. So it wasn't easy. I did not love pregnancy. I loved the outcome of the pregnancies. But after 6 goes at it and finally getting one through to the keeper, I couldn't be happier with and then after that, it set something off and another one came along unplanned a few years later. So it's a wonderful, wonderful thing. And to see so many babies due to arrive soon in this place. The clucks are getting very loud, I can tell you, but at the tender age of 44, it is off the cards. And I have stopped. The member for Warrandyte earlier said that I had commented on Instagram that I've stopped drinking the water in this place. This is true, just in case. I know it is safe drinking water and it will only get safer, but just in case. So, look, this, again, I'm more than happy to speak on any reform that improves positive health outcomes for Victorians and positive health outcomes, and allows those that have had a difficult journey to parenthood a much easier journey, that's got to be a good thing.